Hi, everyone. I'm Rachel Hawkins with Angler Insurance, and today with me I have Blake Mosier with imagine360. We are going to be talking about reference-based pricing, also known in the industry as RBP, and the frustration that a lot of employers have about how to manage healthcare, and it's so unsustainable, lack of transparency. So Blake, can you help our audience of employers understand a little bit more about what you do and why it might be a good idea to partner with us?
Sure can. So I think first and foremost, in a world where there's not a lot of options, unfortunately, in our healthcare space, as you and I have talked about many a times, reference-based pricing really does become a newer, another, whatever term you want to say, viable option for employers that are looking to do two things: lower their spend and control their spend going forward on their medical care, and then also be able to provide a better, more robust, richer benefit for their employees. And if we think about traditional healthcare, the way we're purchasing it today, there aren't a lot of many years where we don't have to increase our premium or increase our cost share for our employees, or raise our deductible or raise the copays. I mean, that's just where we sit. Reference-based pricing becomes an option that allows you to not have to do that. It allows you to better your benefit, enrich your benefit, lower your overall spend, lower your employee spend. And we do that at a very simple way. What reference-based pricing does is it uses Medicare as the base of cost and then pays a fair price over and above it. Typically an amount that allows the facility to make a profit as well as cover their costs. I always joke around. We're not trying to build new wings in hospitals. We're trying to provide the best possible care and pay for doctors. And the way we do it today, we pay this pie in the sky number that no one really understands, charge master, and then we get a discount. Well, what is that discount? It's one thing at one, it's another at another. It depends on the facility, depends on the doctor. No one understands it, and no one knows what they're actually paying. And that's the whole idea of reference-based pricing. Lift the veil, create transparency, and lower the cost for a member, lower the cost for an employer.
I think that was a great explanation, and I couldn't agree more. I think for me, being a benefits advisor, most of the time I'm meeting employers where they're at today. And a lot of times that's fully insured. And I think sometimes they don't realize there are other alternative funding options. And so I think the journey that we see a lot of people is, hey, we're going to meet you where you're at, and then we're going to educate you and teach you. Is it level funding? Is it self-funding? Is it self-funding through a medical captive based off of your size? And I think for your guys' product, what is the ideal group size for companies that are like, hey, well, I have 100 employees. Is that an ideal group for you and what you're looking at?
Yeah, I think it's going to be different, everywhere you are. State's going to determine a lot of it. There's other components in this world when we start to talk about reference-based pricing that do drive some of that. But I think as a general rule of thumb, we can look at least in the state of Washington, 100 to, really as large as you want to go when we start to talk about self-funding. Now, is that to say that a group that's 50, 55, 45, even 25 couldn't self-insure and take advantage of programs like ours? Not at all. There's just things where there's a space where it becomes easier to get some of those components and place some of those other components. So there's obviously ways, there's always ways, but rule of thumb in the state of Washington, probably 100 plus, right?
Yeah. Yeah, I agree with that. And I think when employers, we're constantly hearing, hey, well, this is just what I've been told, and double rate increases is kind of the norm. Where are you seeing cost savings from an employer's perspective? So if we do have someone that is interested in saying, hey, I'm ready for a change, I'm ready to take control of my healthcare spend, and we want to start exploring this path, about how much are you seeing a cost savings compared to their traditional plans?
In our world, and we've done a lot of studies around this, we see on average 20 to 30% savings. We've had studies done to validate that. And the number that we came back with there was 19.2% savings when moving to RBP. That 20 to 30 encompasses some other things that happen when you make the transition from fully insured or a bundled ASO approach, even in self-funded, to an unbundled approach, and leveraging things like reference-based pricing and some of the other tools and resources that we can pair with it. So there's always a potential for more, but let's be modest and say 20% is what we're seeing. And that goes back to my earlier comment. Where else can you find a true 20% savings while enriching plan design and not raising employee contribution? I mean, those are those levers and the strings that we've typically pulled. Now we have a lot more, and we can truly see savings, which we can then leverage in other areas of our business.
Yeah, I agree with that. I think for me is why I specialize in medical captives as being the primary target is a lot of employers that I'm working with in our community, they're not 1,000 life group. Most of them are under 250 lives. And with a medical captive, we can go 25 employees enrolled up to about 250 is the size that I like to work with. And that allows people and employers to say, hey, I want to start exploring these alternative funding options, but I'm too small to self-insure on an island by myself. So by going through a medical captive, it's going to add in that extra layer of reinsurance and protection. You're collaborating with other employers that are like-minded. And at the end of the day, if you want to make an impact, you're going to have to try to find the partners that are aligning with your goals. I think we see that all over the industry. There's a lot of carriers that might not be aligning with what you're trying to achieve. And so I think that it's very fascinating about how reference-based pricing can play into that piece for that cost savings, and also providing the employees. Because when I talk to HR directors, their primary focus is we want to make sure our staff is happy. And allowing those employees freedom of choice, go where you want to go, and taking off kind of this Band-Aid of you have to stay in this network is huge. I think that gives those employees that freedom that they're ultimately searching for. So it's kind of a best of both worlds, I would say, right, between employer and employee. What's your take on that?
I think it's interesting. I think, historically we've been taught and told that, having access to every single doctor, and that's the crux of why you go with one carrier or another, is because we have the biggest network. Well, there's trade-offs there. So we've been kind of trained that it's the network, but there's other ways to approach it. There's other options that give you access to all the doctors without leveraging a network. And there's ways to build that. There's, ways to find savings through the flexibility that what we're talking about presents. There's the captive, the potential. There's, truly self-funding on your own if you're large enough. There's all of these things that you can do that can generate savings that don't rely on a network discount. But that's all we've ever known. And I think that's where just educating on what self-funding really is. And it's not taking all that responsibility on your own, right? And that's the fear that I think some employers face when they hear it for the first time. There's things like captives, and we love captives, and we participate in a number and have, clients that are in a number. And then we have a number that are on, and have their own stop loss and shop it in a number of different ways. But again, it all comes back to creating options, creating choice, and finding the right solution for the right employer, and meeting them where they are and what they're looking to achieve. And, we understand that reference-based pricing isn't right for everybody. Wish it was, but we understand that it's not. But if you're looking for a new way and you start to ask some of the questions that you've been asking me and we've been talking about, there are other options out there. And again, it's captives, it's looking at pharmacy, it's looking at administrators, it's looking at things like reference-based pricing. But again, moral of the story is we have options, we have choices that historically we haven't had. And we just
Yeah.
need to ask about them.
No, I agree. And I think sometimes when both of us are here in Washington State, and when we go to conferences and we're talking to people nationally, this is very common, especially on the East Coast, Midwest. And I don't know why. I feel like it hasn't made its way here to be part of the mainstream on the West Coast, especially in Washington State. So these strategies that we're coming up with aren't new. They've been around a long time. A lot of employers are taking advantage of this. I just don't think it's something that's talked about a lot within our local market. So I really appreciate you taking the time to join me today and having this conversation. I hope that people learned some more about reference-based pricing. Maybe as next renewals come around, they're going to start to think a little bit differently. And the other great thing is you don't have to wait till renewal. You can start the process now. I mean, that's really the best part is if you just ended your renewal, let's start talking about a strategy and a game plan. I can't tell you how many employers I'll sit down with. One of them was over 100 life group. And I said, what's your strategy? And they just kind of sat there and like, we don't have one. That's scary. Let's start doing that now because there are definitely solutions out there to tackle this nightmare of healthcare costs rising and a lot of different solutions. So, Blake, do you have any closing thoughts for our audience?
I think, the last thing that I would say is, we are a little behind out here in Washington in the West. And it's not just us, it's kind of the West in general. Unlike other states, we have historically had more choices with HMOs and multiple blues and multiple other carriers that not every state does have, but there's other options out there. And to your point, there's a conversation about strategy that can be had. That's not how are we going to handle your 4, 5, 10, 12, 20% renewal, but how can we start to save money and set ourselves on a better course for the next 10 years so that we're not there in 5, we're there in 10, as to those numbers that we know we're probably going to get to eventually. But I would say, ask the questions. There's options out there. We'd love to have the conversation. Reference-based pricing is the core of what we do, but that's just a little piece, as we all like to say. I mean, my nieces and nephews could probably figure out how to reprice a claim. There's a lot that comes after it, and we'd love to talk about it because unlike discounts, we talk about service and support and how we're going to get your folks in front of doctors and help them on their care plan and get them healthy versus we have the best discount in the market.
Yeah, I agree. Well, thank you very much for your time today. And I think for any of our listeners, you can reach out to me if you want to know more. You can also reach out to Blake. He is very active on LinkedIn. So if you are on social media, please find Blake Mosher with imagine360. He does post some content, which is also very informative if you want to know more. And we will close it out with that. Have a great day.